Hey, hometown team. I want to take a moment to speak directly with you about where we are today, the changes ahead, and how we're moving forward together as Hometown Health System. First, I want to say thank you. I'm very grateful for each and every one of you. Hometown exists because of the people like you who show up every day and care for others. Whether you're answering the phone, helping a patient, filling the prescription, coordinating care, supporting a family, or solving a problem that others simply cannot, we see you and your work matters. Our story started right here in Camelsville with a community pharmacy and the belief that helping a patient sometimes requires more than handing them a prescription. It's about seeing that whole person and helping people get the support they need. It may mean helping someone find food, clothing, transportation, housing, mental health care, addiction treatment, employment, or simply a person willing to listen and help them take the next step. That belief has grown into something so much bigger. Today, Hometown services communities through pharmacy, healthcare services, behavioral health, addiction medicine, care coordination, and community support programs. We've created more than 60 fair chance employment opportunities for individuals and families. We support thousands of Kentuckians through our facilities, services, programs, and partnerships. We should all be very proud of what we've built. At the same time, growth brings responsibility. We've grown quickly, and now we must strengthen the systems that support us. We have to be more intentional with our finances, our communication, our workflows, and how we make decisions. The changes we are making are about protecting what we have built, protecting our patients, and you, the employees, and the mission that brought us here. Moving forward, we're going to focus on 4 things. First, stronger financial responsibility. We're improving our reporting and processes so we can build a stronger foundation for the future. Second, consistent processes. Every department and location must have clear expectations and reliable workflows. Good care depends on good communication. Before a service is scheduled or provided, the appropriate team must confirm eligibility, benefits, authorization requirements, documentation, clinical readiness, and the likelihood that the service will be reimbursed. Clinical notes must be timely and complete. Pharmacy, medical, behavioral health, scheduling, billing, and administrative teams must communicate with one another. Patient follow-up cannot depend on informal conversations or someone remembering to make the call. Third, accountability. Every person and every team plays an important role. We'll continue to measure what matters: quality, patient care, documentation, access, operational performance. This is not about turning patient care into a number. It's about making sure that our work produces the outcome we intend for the patient and for the organization. Fourth, thoughtful growth. We must continue to pursue opportunities, but we must be sure every decision supports our mission and strengthens the organization. Growth will no longer move forward based on an opportunity alone. Every new service, contract, position, or location must have a clear need and an operational plan, a compliance pathway, a financial model, responsible leadership, and measurable outcomes. Sometimes that will mean moving more slowly. Sometimes it will mean saying no. Sometimes it will mean changing a role, schedule, workflow, or reporting structure. Those decisions are not being made to punish anyone or assign blame. They're just being made to ensure that hometown remains strong enough to serve patients and employ people for years to come. I also want to be clear about what we need from each other. We need reliability. We need employees who arrive prepared, complete their responsibilities, communicate when they need help, and take ownership of the work assigned to them. We need accurate and timely documentation. We need employees to follow established procedures rather than creating informal workarounds. We need concerns escalated early, not after a patient's upset, a claim's denied, medications delayed, inventory is missing, or a financial problem has grown. We need everyone to protect the company time, patient information, inventory, equipment, cash, and other organizational resources as carefully as they would protect their own. We need professional communication. There may be questions during this transition, and there may be decisions that are difficult. Questions and concerns should be brought directly to leadership through the appropriate channels. We cannot allow uncertainty, assumptions, or rumors to divide the organization. Most importantly, we need to stop thinking of ourselves as separate departments or separate locations. Connected healthcare requires connected employees. A front desk decision affects a nurse. A clinical note affects a biller. A prior authorization affects a pharmacist. An inventory decision affects cash flow. A delayed referral affects the patient and other departments. Every handoff matters. Our patients do not experience their lives in departments. A person may need primary care, medication, mental health care, transportation, housing assistance, infectious disease services, addiction treatment, and employment, all at the same time. Our goal is to make sure that no matter where someone enters hometown, they can be connected to the care they support and they need. Our patients do not see us as separate departments. They see hometown, not fragmented healthcare, connected healthcare. And we cannot provide connected healthcare through disconnected operations. Leadership also has responsibilities. We owe you clear communication. We owe you defined expectations. We owe you training, appropriate tools, timely decisions, and leaders who follow through. Accountability must apply at every level of the organization, including executive leadership. This is a defining moment for Hometown Health System. We can allow the pressures of growth to divide us, or we can use this moment to become stronger, more organized, and more unified. I believe deeply in what we are doing and what we are building. Healthcare access and medication continuity are simply not simple services. They are community infrastructure. Every patient we stabilize can become more stable. The parent, the neighbor, the member of the community, our roots are here in Campbellsville, but the work being done by this team is reaching communities throughout Kentucky. God has continued to open doors for this organization, but walking through those doors requires responsibility, preparation, and stewardship from all of us. The next chapter of Hometown will require humility, courage, accountability, and unity. One hometown, one standard, one mission. Thank you so much for your work and your commitment and your willing to move forward with us together. We appreciate each and every one of you so much, and we can only do this with you. We can't do it without you. We can do it with you, and we're so grateful for each of you.